What is trigger finger? Trigger finger, also known as stenosynovitis, is a condition affecting the tendons of the hand. It is a painful condition in which the fingers or thumb get locked in a bending position. There is difficulty in straightening the affected finger. Clicking or popping sound is heard on straightening the finger. Trigger finger can appear in one finger or may involve many fingers at a time. Though commonly affecting the right hand, it can affect both hands as well. Trigger finger makes a person anxious and frustrated since it interferes with daily life and work. It affects the efficiency of a person adversely, especially while performing tasks to be done with the hands. Homeopathic treatment. Homeopathic treatment for trigger finger is very effective. With the use of homeopathic medicines, the intensity of symptoms like pain, stiffness, and frequency of episodes gradually declines. To treat any case of trigger finger, case details of characteristic symptoms of the person are required to find the underlying cause. The symptoms are important for the selection of the most suitable medicine for the patient. Homeopathic medicines treat trigger finger by correcting the underlying cause, inflamed, thick tendon sheath in most cases. Homeopathic treatment for trigger finger is natural, safe, and has no side effects. These are recommended for mild to moderate cases of trigger finger. What are the causes of trigger finger? Trigger finger is caused by irritation, inflammation, scarring and thickening of tendon sheath of the fingers and thumb. Tendons are the strong tissue bands that link muscles to the bones. There is a covering on the tendon called the sheath. In normal conditions, there is smooth movement of the tendon within the sheath while bending and straightening the thumb and fingers. In cases of trigger finger, the space between the tendons and its sheaths becomes narrow due to inflammation or thickening of tendons or sheath of the affected fingers or thumb. This narrowing leads to pain and restricts the movement of fingers. What are the risk factors for trigger finger? 1. Overuse of hands with frequent and repetitive movement of hands and fingers puts a person at risk of getting trigger finger. Individuals who carry out regular or continuous straining movements, like gripping something for a prolonged time, are prone to getting trigger finger. Persons in certain occupations or activities in which there is a constant straining of the fingers and hands tend to suffer from trigger finger. Musicians, farmers, and laborers are at high risk of developing trigger finger. 2. Apart from overuse, medical conditions like diabetes mellitus, rheumatoid arthritis, an autoimmune condition that causes inflammation of joints, and gout, inflamed joints from high uric acid levels, also make a person prone to trigger finger. 3. Age, persons between 40 to 60 years of age at risk. 4. Sex, females are more likely to suffer from trigger finger than males. 5. Surgery of carpal tunnel syndrome, numbness and tingling in fingers from pressure on median nerve. What are the symptoms of trigger finger? Trigger finger can affect any finger or thumb, and either hand can be affected. It can affect multiple fingers at the same time. 1. Mild stiffness or tenderness at the base of the thumb or affected fingers. It is the initial symptom. The stiffness is more in the morning or when the person initiates movement. In some cases, the patient may get relief by continuous movement of the fingers. 2. Pain at the base of the affected finger/thumb. It is felt on movement or applying pressure. With the progression of the condition, pain may be felt even when the hand is at rest. 3. Affected fingers get locked on bending as the disease progresses and the person finds it difficult to straighten locked fingers. 4. Popping or clicking sound on moving or straightening the affected finger. 5. Locking a finger in the bent position which the person may have to unlock with the help of the other hand in advanced cases. At times there is inability to straighten the finger. 6. Formation of nodosities at the base of the affected fingers in palms. Grading of trigger finger. Grade 1, only pain and tenderness in palm or fingers, there may be a history of bent finger. Grade 2, there is catching, bending, of finger but can be actively extended. Grade 3, unlocking of finger requiring passive extension, using the other hand to unlock. Grade 4, fixed locking of finger. Homeopathic medicines for trigger finger. The top homeopathic medicines for trigger finger are Rhus tox, Ruta graveolens, Arnica montana, Causticum, Merc Sol, and Sulfur. 1. Rhus tox, top grade medicine. Rhus tox is a highly recommended medicine for cases of trigger finger. It has magnificent action on tendon and its sheath. Any complaint that arises from overuse or overstraining of tendons can be addressed wonderfully with this medicine. Here, overuse or overstraining of tendons of fingers is the root cause behind trigger finger, for which Rhus tox is the leading medicine. In case joint inflammation is associated with trigger finger, there too Rhus tox is effective. It is helpful in cases of trigger finger where there is noticeable rigidity and stiffness in the fingers during initial movement, especially in the morning. Patients needing this homeopathic medicine get relief by moving their fingers and hands continuously. The problem may aggravate by resting the hand. When and how to use Rhus tox. Rhus tox can be used as a first line of treatment in cases of trigger finger where stiffness is marked in fingers. It will reduce inflammation of tendon, its sheath, and reduce stiffness of fingers. It can be used in different potencies from low, 30C, to high, 200C, 1M, potencies. Initially, Rhus tox 30C is the most preferred potency that can be taken 3 to 4 times a day at a 3-hour interval. High potencies are usually not repeated too often, and homeopathic physicians' advice is a must. 2. Ruta graveolens, for overstrained, inflamed tendons and nodes on tendons. Ruta is a natural medicine prepared from garden rue plant. It is very effective in treating trigger finger caused by overstrained or inflamed tendons of the hands. Additionally, nodes get formed on the tendons. The fingers get contracted. Tearing or drawing pain is felt in the fingers and hands. When and how to use Ruta graveolens. Ruta can be used in case of pain in fingers and hands where tendons are inflamed along with node formation from overstraining. Though it can be used in varying potencies, the most frequently used potency is 30C, which can be taken 2 to 3 times a day. 3. Arnica, for complaint from overstraining or overexertion of hands. Arnica is similar in action to the above 2 medicines. It is well indicated when trigger finger develops due to overstraining or overexertion of the hands. The patient needing it has soreness and pain in the fingers that gets worse with the slightest touch. When and how to use arnica. When this condition arises from overstraining of hands along with pain and soreness of hands, arnica can be used. It gives excellent results in 30C potency. Arnica 30C can be taken 2 to 3 times a day as per severity of pain. 4. Causticum, for stiff fingers with difficulty in moving them. Causticum is a very useful medicine for cases having marked stiffness of fingers. The fingers get bent over the palmar side with difficulty in moving them. These can only be moved with the help of the other hand. Tendons of fingers get contracted and hardened from long-term inflammation. When and how to use causticum. Consider this medicine's use when fingers are stiff and bent from contracted and hard tendons. 30C is the right potency to use in beginning. Causticum 30C can be taken once or twice a day as per the intensity of complaint. 5. Merc Sol, when there is locking of fingers/thumb. Merc Sol is valuable for cases of trigger finger where there is locking of fingers or thumb. The fingers/thumb may be completely bent on the palms. There is excessive struggle to open the locked fingers without assistance from the other hand. Besides, there is stiffness in hands while using them. On moving the hands, fingers make a cracking sound. When and how to use Merc-Sol. Merc-Sol can be used when there is the tendency of fingers or thumb to be completely bent on the palm and get locked there. This medicine will gradually help to reduce frequency and intensity of such episodes, though it may not help much in unlocking if the fingers are acutely bent. It can be taken in 30C potency twice a day for good results. 6. Sulfur, for locked fingers when grasping something. Sulfur can be considered in cases where the fingers lock when the person tries to grasp something. There may also be nodules on the fingers and cracking of finger joints in such cases. A tearing pain may be felt in the hands. Burning sensation in palms may attend. When and how to use sulfur. When there is tendency to get locked fingers on grasping some object, sulfur can be considered. Sulfur 30C once a day can be taken to reduce such tendency. In case no changes occur, higher potencies can be used after consulting a homeopath.
Thanks for watching the video. If you liked the video, please like, share and subscribe the channel and press the bell button for more upcoming new informative videos.